So diabetes affects over 38 million people in the US, and approximately 25% of that population is going to suffer from what we call painful diabetic neuropathy. Diabetics have elevated sugar, and that sugar ends up being toxic to the microvasculature system as well as the neurons in the nervous system. You end up getting injury to these nerves to where they're no longer regulated and become hyperexcitable. Current treatments primarily for this neuropathy pain, where you get burning, numbness, tingling, loss of sensation, usually focus on neuropathic medications. The problems with these medications is that a lot of times they're limited in that they're not really great at controlling the neuropathy pain, but the other component is that they oftentimes have a lot of different side effects. Additionally, there's no way for you to regain your sense of sensation. And so a novel therapy that's been FDA approved as of 2021 has been the use of spinal cord stimulation for the treatment of painful diabetic neuropathy. Although it is a surgical procedure, there is a trial phase that you get to try the device before you so-called have the surgery.
Trials are typically 5 to 7 days. And we do this so that we can make sure that this technology is a good fit for you and your pain complaint. What we do is there are leads, and I always tell people, just for reference, the leads are about the size of spaghetti. They're basically put into the epidural space, and what that really means is the space between the outer covering here of the spinal cord and the bones. It's usually several millimeters, and we access that space on both sides of the spine with an epidural needle. From there, we thread the leads into the epidural space, and we drive them through direct vision with fluoroscopy, where we can see where they're going up to the level that they need to go. And they hook up to a battery. The batteries are usually about this size, and during the trial they'll be external. Usually they're stuck to a little pocket that sticks to your skin and stays under your clothes. For that time period, you'll work with the representative from the company that is part of the trial, and they'll work on the stimulation pattern with you to optimize your pain control. So hopefully by the end of that 5 to 7 days, we've achieved good enough pain control to where you would want to move forward with a permanent implant. And that is where we would partner with the neurosurgery department to implant this surgically for long-term pain relief.
The really unique thing about the procedure is that we have fantastic data on this that now spans over 2 years, that shows that not only do patients in the trial have gotten significant pain relief, but they've also regained sensation. This is particularly important for diabetics because as they lose sensation, you become more prone to injuries and falls. Regaining that function and being able to catch things a little bit earlier because your ability to feel sensation and balance and prevent falls. And I think that's what's really exciting, is the tangible pain relief that's long-lasting based on the studies, as well as the regain of sensation. If you or someone that you know suffers from painful diabetic neuropathy is interested, please feel free to reach out to our office so that we can kind of evaluate you and see if you might be a candidate for this type of procedure.